Hey, everybody, welcome to another episode of the Hidden Causes, the Fatigue and Autoimmunity Workshop, where we are on a mission to help you figure out your causes of fatigue and autoimmunity so with laser-like efficiency, you can resolve them. So today we're going to be talking about sinusitis, inflammation of the sinuses, with my friend, Dr. Rav Ivker. So he's been practicing medicine for nearly 50 years. He is a holistic healer, family physician, cannabis clinician, health educator, and author of 8 books, including the best-selling Sinus Survival, Asthma Survival, The Complete Self-Care Guide to Holistic Medicine, and his latest book in 2017, Cannabis for Chronic Pain. Since 2011, in his fully alive medicine practice in Boulder, Colorado, he has worked with nearly 10,000 chronic pain patients using medical marijuana to relieve their suffering. Dr. Ivker is a board-certified integrative holistic physician, the co-founder and past president of the American Board of Integrative Holistic Medicine, past president of the American Holistic Medical Association, and a fellow of the American Academy of Family Physicians. And I first met him in the American Holistic Medical Association back in 2002, 2003, when he was president there. And his lectures on sinus health and sinusitis just blew my mind. So Dr. Ivker, thanks so much for being with me today.
It's a pleasure, Evan, to be with you.
Excellent.
Thank you for having me.
Of course. It's really a privilege and an honor. So let's dive into sinusitis, this pain and inflammation that people have up in their sinuses. What is sinusitis?
Sinusitis is an inflammation of the mucous membrane, the respiratory mucosa, the outer lining of the respiratory tract. And the respiratory tract consists of just the nose, the sinuses, and the lungs. So sinusitis, chronic sinusitis, is actually the most common respiratory disease on the planet.
Wow.
And it wasn't always so. It's been the past 40 years that it became so common, probably because of our modern day plague of air pollution. We breathe on average about 25,000 times a day, and the nose and the sinuses their primary function is to filter the air we breathe and humidify it. So the air quality has a whole lot to do with the condition of the mucous membrane. And it's a major contributor to inflammation. And when a mucous membrane is inflamed, it secretes more mucus and it swells. And we get stuffy and a lot of postnasal drip, and it can cause pain, facial pain, forehead, but that's and the challenge of treating this condition is that, as we've learned, and most people are aware at this point, the body is a self-healing organism. The body will heal itself if you give it a chance. And that's the challenge here with chronic sinusitis. I mean, for instance, a good example is if you broke your leg and you had a cast applied to your leg and you walked around on crutches for 6 weeks, and you then had an x-ray and the bone is completely healed and you're good to go. The cast comes off, the crutches are gone. And what did you do for 6 weeks? No weight bearing at all. You didn't use your leg. Well, the problem with the sinuses is you can never stop using them. as long as you're breathing, they're they're in use. So it is a challenge to heal the mucous membrane while you're using it. And it's a multifactorial condition because there are many other contributors to this inflammation. Smoking, for instance, is probably the worst thing you can do to the sinuses. Infection, the most common trigger for causing sinus infections, which is considered acute sinusitis. That's when you really are sick and more tired, more pain, more mucus, you're more stuffy. The mucus is purulent, green, yellow mucus. It's almost always triggered by the common cold. So most people with chronic sinusitis don't get a routine cold. Their colds almost immediately become sinus infections, and they're sick for 2 or 3 weeks. And they may get several of those infections every year. And most people are treated with an antibiotic. And that's the next problem, because so many of these people who have had multiple courses of broad spectrum antibiotics develop fungal sinusitis, which is even worse. It causes more inflammation, more weakening of the immune system, and extreme fatigue. These people are really almost incapacitated. I've seen many people who are unable to work with fungal sinusitis. It was really just identified in 1999. There was a landmark study at the Mayo Clinic where they concluded that all cases, I mean, I always pay attention when in medicine, when the word all is used or never, because there's always an exception. But they said all the cases of the cause, they came out and said the cause of chronic sinusitis is an immune dysfunction mediated by a fungus. They didn't say candida, but that's the type of fungus that is usually the cause. But since the early 1990s, and to an increasing extent over these last 30 years, I've seen more and more frequent cases of severe fungal sinusitis. Nearly every one of my sinus patients has some degree of fungal sinusitis. And fatigue is a major component. The purulent mucus and congestion, and basically they have a weakened immune system, and unfortunately, it really is unfortunate because most of conventional medicine doesn't recognize the existence of this condition of fungal sinusitis, because even in 2021, we still don't have a consistently reliable lab test to confirm that diagnosis.
Right.
So I have to make the diagnosis by virtue of their history and what they present with. And I use Dr. William Crook's Candida questionnaire from the 1980s and his book, the yeast connection. And it's a very reliable guide to making that diagnosis, as well as the treatment. If I suspect that they have fungal sinusitis and I do treat it aggressively, because that's really how you get rid of it. And the improvement is typically dramatic. So that's another aspect of confirming the diagnosis.
Excellent. So that's very helpful. So then what's the difference between acute sinusitis and chronic? You talked about it a little bit, but is acute a couple weeks and then chronic is longer than that?
Acute is a sinus infection, which people are sicker. And it usually lasts for a couple of weeks. And then it diminishes, but it's still not, it's never completely gone.
Mm-hmm.
I mean, that's what chronic sinusitis is, an ongoing inflammation. The inflammation is more severe when you have a sinus infection or acute sinusitis, but with people with chronic sinusitis, the inflammation is always there to some extent, which is why they have ongoing symptoms of congestion and mucus and fatigue and irritability, and they're really people with a weakened immune system. So my treatment program is focused on healing the mucous membrane by reducing inflammation, and at the same time strengthening the immune system.
Okay, so then you talked about the Mayo Clinic study, which I quote all the time. It's a very important landmark study, and then you talked about the fungal element. Is there what percentage would you say in terms of like an infectious caused chronic sinusitis? How much is viral, bacterial, fungal?
I think funny, I've never thought about it in those terms, but I think over 90% of sinus infections begin with a viral infection,
Okay.
the common cold. And then it becomes bacterial.
Okay.
And if it's in conjunction with fungal sinusitis, with an underlying candida overgrowth, it can be bacterial, viral, and fungal all at the same time.
Okay.
Which is why I am so thrilled that for the last 20 years, I've been using a supplement, Alamed. And Alamed is 100% pure allicin.
Mm.
And allicin, which is produced in England, they've done studies in England, published studies on how effective it is as an antiviral, antibacterial, and antifungal. This product kills MRSA, which is an antibiotic resistant staph. And it doesn't respond to any antibiotic. So rather than trying to figure out what you're dealing with, viral, bacterial, fungal, I treat it with Alamed along with other strong antifungals, and the improvement is just dramatic with most patients.
Mhm.
People who have been suffering for years and haven't seen any improvement and have been told by their physicians, their ear, nose, and throat doctors, you're going to have to live with this.
Right.
Just as I was told in 1980. I was 33 at the time. You're going to have to live with it. I mean, he did offer me surgery, but then he said, fortunately, he told me, well, I can't really guarantee that the surgery is going to cure the problem. I said, well, why would I want surgery then? So,
Right.
so that's when I made a commitment to cure it. I said, I can't live like this. So it took me 7 years, but
Wow.
I cured it in 1987. I haven't had any problems since.
And was your cause fungal as well?
I did not have, I don't think I had fungal sinusitis.
So then how did you cure yours?
I started by changing my diet. I eliminated ice cream, dairy. Uh, I used to have a bowl of ice cream every night before bed. And just that one intervention, I saw a major improvement right away. And then I started using a saline nasal spray every day, and I saw a big improvement, but it wasn't cured until I spent a full year, 1986, working with a spiritual psychotherapist.
Hmm.
And he taught me really about the importance of the mind-body connection and how my thoughts and beliefs affected my body. And he taught me about affirmations and the healing power of love. And I basically learned to love myself, and at the same time, love and nurture my mucous membranes. And by early 87, I was cured. And
Brilliant.
I've had some sinus infections in these 30 years since, but I don't even get colds anymore because this Alamed, I always keep around. I always have a bottle in the refrigerator, and at the first symptom of a cold, which is usually a sore throat, maybe some sneezing, I will take 2 days of Alamed, 2 capsules 3 times a day. It knocks it out. The virus is gone. So the most common trigger, as I mentioned, for sinus infections is the common cold, the virus. And if you can prevent the cold, then you don't get sinus infections.
Hmm.
So it's basically learning to listen to your body. And that's what I've done.
Brilliant. So if we're looking at the causes of chronic sinusitis, we've got infectious, we've
Right,
got allergy,
right,
we've got lack of love. Would you call it that?
right. The perceived loss of love.
Hmm.
The perceived, it's very important word. And I consider, I mean, the essence of holistic medicine is the belief that unconditional love is life's most powerful healer, and its corollary, the perceived loss of love. is our greatest health risk. So it's really, it's so fascinating to see when I ask people, when I ask my patients, well, what was going on when this all started? 3 years ago when you started having sinus infections.
Mm-hmm.
And it's almost always a very stressful time. And what's really fascinating about these patients is that there's a very common personality trait that they all share. Sinus sufferers are almost always high achieving perfectionists.
Mm.
They hold themselves to a very high standard of performance. And if they don't meet their own standards, they really give themselves a hard time, very hard on themselves. And the emotion that's most often associated with sinusitis is repressed anger.
Mm.
And they're typically angry with themselves and for making mistakes, perceived mistakes. So it's just fascinating. The asthmatics, almost all of them grew up with a smothering mother. It's called enmeshment.
Mm.
And an absentee father, either physically or emotionally or both, and a lack of bonding between the parents, and a lack of affection in early childhood, the perceived loss of love. So it's just fascinating because that's we're talking about the root cause now.
Mm.
I mean, I don't get to this immediately, but in the first session, I give them an overview, and then I give these patients the tools to see a quick improvement. And that usually hooks them into the program. Wow, that really worked. And that was only a month. So I ask for at least a 3 to 4 month commitment to really see a major change and to maintain it. Because most of my patients feel better than they have in years.
Mm-hmm.
And that's enough motivation to continue with the program. It is a lifestyle change, and they usually will maintain those changes, which start with diet. And it's an anti-inflammatory, hypoallergenic, candida controlled diet.
So that's at that first appointment.
Yes.
Mm-hmm.
Yes. And the nasal hygiene, because most of these people with chronic sinusitis, there's a biofilm that covers the mucous membrane. And I recommend steaming with essential oils, eucalyptus oil and peppermint oil, tea tree oil. And then I follow the steaming with nasal irrigation. But there's only one nasal irrigator that I've found that breaks up the biofilm. And that's a Sinupulse. It's a pulsatile It's the same technology as the water pick device for your teeth.
Mm.
And it's been shown that it does break up the biofilm. So you can get directly, you can heal the mucous membrane much more easily. And it also makes it possible to treat the bacteria, the antibiotic resistant bacteria, the Marcons and MRSA, the staph infections that don't respond to any antibiotics. And the reason is, one of the reasons is this biofilm.
Mm-hmm.
And if you can break up the biofilm, and the neti pots and other irrigating devices are fine, but they don't affect the biofilm.
So the Sinupulse must be a big forceful flush then.
It's somewhat gentle.
Okay.
Yeah, I mean, it's not. It's the pulsatile. You know, have you ever used a water pick?
No.
Oh, well, it's the pulsatile action that
Okay.
breaks up the biofilm.
Okay. What do you think about things like xylitol nasal spray or putting herbs into the neti pot to break up the biofilm and kill the infections?
Well, I think xylitol is fine. I use a nasal spray. It's called the Sinus Survival herbal nasal spray, and it has aloe and other anti-inflammatory herbs. In addition to berberine,
Oh, nice.
which is anti-infective.
And so
So
do you find that can people get better just from taking oral herbs, or do they also need the more topical approach up the nose?
it's much more effective to spray your nose.
Mm-hmm.
And I recommend that they do it every 2 to 3 hours.
Oh, okay. And do you find that, I mean, is it really localized, or do generally, if people have candidiasis, yeast in the sinuses, fungus in the sinuses, is it also all over the body?
That's right. It is systemic. They usually have GI symptoms and bloating and gas and indigestion. Candida is a normal inhabitant of the body,
Mm-hmm.
and it's found in the mucous membrane of the respiratory tract and the GI tract primarily, and in the vagina. And when you have candidiasis or candida overgrowth or fungal sinusitis, it affects the whole body, which is why fatigue is such a major symptom. I think that's probably the most prominent symptom with fungal sinusitis.
Yeah,
Yeah,
and so
they come to me because they have the sinus problem, but they complain most about the fatigue.
mm-hmm. So it sounds like the symptoms you've mentioned, fatigue, there's the facial pain, there's the increase in the junk, the purulence you talked about coming out of the
Mucus, yeah.
sinuses.
And it's usually
Mucus.
post-nasal, down the back of your throat,
Mm-hmm.
rather than a runny nose.
Gotcha. Any other main symptoms that you see that would be pathodiagnostic?
Those are the main ones.
Okay. So
Um,
then, so then in terms of like this fungus that
oh,
you're
headache.
seeing, oh,
Headache is
headache.
a prominent symptom.
Oh, okay, thank you. That's great. So all of those, if somebody has all of those or most of those, would you say that then you know that they have chronic sinusitis?
Yes.
And the majority of those people are going to
And it
be
doesn't go
fungal.
away either. I mean,
Mhm.
it fluctuates. You know, it can get a little better, a little worse, and you know, and in between they will have a sinus infection 2, 3, 4 times a year, but they never return to completely normal
Right.
function.
And how much of these infections do you believe are candida versus mold?
That's a tough one. I mean, I have seen a number of people that have mold exposure in their history.
Hmm.
And in a few, that's when it all started, but not always.
Hmm.
It just got worse after the mold exposure.
Right.
You
And
know, they
do you find that you have to give a different sort of treatment if they do have that sort of mold picture as well, or does
yeah,
it respond?
I'm more aggressive with the antifungal aspect of the treatment.
Hmm.
I I might use an antifungal medication, or diflucan, or itraconazole,
Hmm.
Sporanox. Uh,
Okay.
and I usually reserve that for the most severely infected people, people who are really sick to the
Okay.
point of being almost incapacitated,
Hmm.
where they can't work. One lady I just I'm still working with is disabled.
Mm,
She's on disability.
right. Yeah, when it takes over the body, there's a lot of challenges there. So let's talk
Oh, and then
about.
also
Oh, go ahead.
one other thing,
Yeah.
because I thought about this woman, um, mental fog,
Hmm.
very common symptom
Agreed.
associated with fungal sinusitis.
Hmm. So then two questions left. First question is, if there was one thing that you would recommend for people to do right now at home to improve their fatigue or autoimmunity, what would it be?
I would change your diet and go on a really strict uh, candida control, anti-inflammatory, hypoallergenic diet, which is
Mhm.
really vegetables and protein. Um, it's almost you totally eliminate carbs, sugar, dairy, red meat, um, and I get a good night's sleep every night. I mean, sleep is so overlooked,
Mm,
and it's so important for the function of your immune system. For optimal functioning of your immune system, you
mhm.
need good quality sleep
Amen.
consistently.
Mhm.
So, two things. Those two things would make a big difference.
Big difference, absolutely. So, Dr. Rav, where can people learn more about the work that you do?
My website, Fully Alive Medicine, and on the website, right on the home page, I have my updated and the new sinus survival. It's a synthesis of the sinus survival and asthma survival program. I call it Fully Alive, Breathe Easy.
Nice.
And it's a pretty good overview of the whole program.
Mm-hmm.
And they can also get a hold of Alamed on my website.
Oh, nice.
And I still think that is the best supplement I've used in my entire career.
Wow. That's saying something.
I don't use antibiotics at all.
Right.
I basically am taking people off of their antibiotics,
Right.
just like I do with the chronic pain patients who want to get off of opioids, and they start using cannabis,
Mm-hmm.
and I help guide them in the appropriate use of cannabis. But it's interesting that, I'm just thinking that that's my practice consists of getting people off of antibiotics and opioids.
Right. That's a brilliant practice.
I
Well, Dr.
have a
Rob,
lot of
thanks.
customers that way.
That's right. Thanks so much for being with me today. Really appreciate you taking the time.
Yeah, it was a pleasure. Thank you for having me.